rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Hello, everyone. Today, I saw a patient with an adrenal cortical tumor after surgical resection. The pathology report raised an important question. Doctor, could this tumor be malignant? Rather than relying on a single pathological feature, let's take a closer look. Our patient is a 52-year-old woman who underwent adrenalectomy for an adrenal cortical tumor. Histopathology demonstrated nuclear grade 3 with a mitotic count of 8/50 high-power fields. Atypical mitoses were present. Clear cells accounted for 20% of the tumor. Diffuse architecture involved approximately 38% of the tumor. Microscopic necrosis was present. There was no venous invasion or sinusoidal invasion. Capsular invasion was identified. Let's assess this case using the Weiss Score Calculator in the OncoToolkit. The Weiss Score is a histopathologic scoring system developed to help distinguish benign adrenal cortical adenomas from adrenocortical carcinoma. It evaluates 9 pathological features, with 1 point assigned for each criterion that is met. Let's enter our patient's findings. First, we'll select the nuclear grade. This tumor is grade 3, so we'll select grade 3. Next, we'll enter the mitotic count. The pathology report shows 8 mitoses per 50 high-power fields, so we'll enter 8. Atypical mitoses are present, so we'll select present. Clear cells account for 20% of the tumor, so we'll enter 20%. Diffuse architecture involves 38% of the tumor, so we'll enter 38%. Microscopic necrosis is present. We'll select present. There is no venous invasion, so we'll select absent. There is no sinusoidal invasion. We'll also select absent. Capsular invasion is present. We'll select present. Now click Calculate Score. Here are the results. The patient's original 1984 Weiss score is 7 out of 9. The operational malignancy threshold has been met. A score below 3 is not definitive evidence of benign behavior. This histopathologic score is not a staging system, prognostic model, surveillance tool, or treatment recommendation. To see how the result was calculated, expand how this result was calculated. The calculator evaluates each of the 9 Weiss criteria individually. For this patient, 7 criteria are met, resulting in a final Weiss score of 7. You can click Copy Result to copy the assessment. To save it, enter the patient's name and click Save. Previously saved assessments can be viewed from the Saved Results panel on the right-hand side. If you'd like to learn more, scroll down to the reference data below. The original Weiss system uses 9 pathological criteria. Scores from 0 to 2 do not meet the operational malignancy threshold. Scores of 3 or higher meet the operational malignancy threshold. Borderline scores should always be interpreted with expert pathology review and the complete clinical context. The clinical workflow section provides guidance on when to use the calculator and how to interpret the results. The Weiss score should always be considered together with pathology review, imaging findings, biochemical evaluation, and multidisciplinary clinical assessment. The Weiss score provides standardized histopathologic assessment, but it should never be used alone to establish diagnosis or determine treatment. For more oncology calculators and clinical decision support tools, explore the OncoToolkit.